A nurse's death highlighting the need for more services for sexual assault survivors.
Now, there are just a handful of these specialized nurses who can actually perform these types of exams. But our 8 News Now investigators finding a long-standing practice sent survivors, often women in crisis, to just one nurse.
8 News Now investigator David Charnes here with why and what's changing, all new at 6. David?
Well, they're called forensic nurses, and it appears it was an unwritten rule to send sex assault survivors to UMC, even though right around the corner there was a provider offering the same service. Tonight, the process of doing this important work, you could say, is evolving.
So for 2.4 million people, 3 million on a busy weekend, we had one forensic nurse in place at UMC.
It's a process across the Las Vegas Valley that's no longer in place. In April, a longtime nurse handling sex assault exams at UMC died, leading to questions about how her services could be spread out. Liz Ortenberger is the CEO of SafeNest, an organization assisting survivors of domestic violence.
Every police department was bringing their survivors to UMC because it's the county's hospital.
The 8 News Now investigators learning it was common practice to send patients in need of an exam right to UMC, to that one nurse, even though several other programs provide the same service. Records show UMC contracts with an outside company providing the exams. State law requires the county to reimburse a hospital for them. The 8 News Now investigators finding taxpayers reimbursed that company more than $1.2 million for those services last year. Another provider, Nevada Health Right, blocks from UMC, received $400,000.
But that's a team of people that should be doing this work.
Instead of a team, it was often that one nurse at UMC working around the clock, both performing exams and testifying in criminal cases. Ortenberger telling lawmakers earlier this year that UMC averages 300 exams a month, a workload, she says, in similar jurisdictions would be assigned to a dozen or more forensic nurses.
There was almost an automatic process of take them to UMC.
Rochelle Eckrews runs Nevada Health Right, that second forensic exam provider that's now working with UMC to provide those services.
Why was there this perception that there was just one forensic nurse in the county?
I think there's a lot of contributing factors to that. Part of that is because there was a resistance and shifting of certain embedded policies or protocols, even whether informal or not or written or not. We would have shifts where we would have no calls. So I would have a nurse on for 24 hours, 36 hours, and not have any exams, to where they can pretty much get guaranteed they're going to get called in one or twice every time they have a shift.
Now, with 5 nurses, both full and part-time, Nevada Health Right is prepared to take over the workload.
We want to make sure our community is served, regardless of where they land for services. We want to make sure they're served.
So 2 years ago, lawmakers also added money to reimburse for strangulation exams as well. And the governor just signed a new law allowing these forensic nurses to bill the state directly. Now, the hope from supporters is to relieve the pressure on the few nurses that are here in southern Nevada. I'm David Charnes, 8 News Now.
In addition, 8 News Now reached out to the other hospital groups across the valley.
Now, a representative from HCA Healthcare, which runs hospitals including Sunrise and Mountain View, said they are partnering with Nevada Health Right.